Hello everyone and welcome back to one of our teaching sessions here at Dr. Coaches. I'm Dr. Carlos Gubero, a GP trainee here in the UK. Today in our course, we're going to be covering day 3, which is going to be talking about eyes, IPS and counseling. So you might be wondering, what's eyes? What does eyes stand for? So eyes is a very useful mnemonic used here in the UK to try to explore patients' thinking process and their thoughts. Now, what does it stand for? I, ideas. So in here we can ask questions to try to gain any possible idea the patient might think could be causing his concerns, such as, do you feel there's anything in particular might be causing your breathless? C, concerns. Now, asking about concerns, you can ask the patient questions such as, is there anything that's worrying you? Are you particularly worried about anything? E, expectations. Try to gain what are the patient's goals from the consultation. So we can ask them, what do you expect to gain from me today or from today's consultation? Or you can ask them, what do you think is the best plan of action? Now, moving into IPS. IPS is a very important part in your PLAB 2 journey. As you might be very well aware from one of our previous teaching sessions, IPS, it's one of the main domains in which you are assessed in PLAB 2, right? What does IPS stand for? Interpersonal skills. This usually tend to be easy points, and we're here to help you get into your maximum level of IPS. How can we reach that? IPS has 2 main domains. IPS can be expressed in a verbal way and into a non-verbal way. So, when do we use IPS? The simple question to is always. We use IPS when we greet the patient, when we explain something to the patient, when we pick up a concern and we acknowledge it, when we are empathic with patients' feelings and patients' emotions. We will be explaining IPS not only in this small section, but throughout the course. One of the most common stations in which we would be displaying IPS would be breaking bad news, dealing with difficult patients, such as angry patients, dealing with problems with colleagues, but not only there, IPS, as I was mentioning to you guys, would be showing up and coming up in all of your stations. Now, we're gonna talk about counseling stations. So, before jumping into most commonly seen counseling stations, I want to let you guys know what are counseling stations. They will vary from your usual history taking, procedure or Siemens station. In what ways? 1, the indication of it, and 2, the structure. Now, usually counseling stations, as the word says, you would be expected to give your medical advice or your medical input to either the patient or a colleague. That's why you counsel them. What's the structure of the station? As previously explained, we build rapport with the patient and introduce ourselves using grips. Then we move on, and on these stations we need to counsel. So, although we need to counsel, we still need to get some brief information from the patient or colleague. How do we do that? We do it by using our P3 maftosa. What are we trying to gain when using the P3 maftosa? Important information that we can use later on in our counseling to the patient. Only relevant bits. You have to remember and bear with us that this is not a history-taking station, but you would still be required to grasp a bit of the events leading into the counseling or to help you counsel the patient. Let's talk about the commonly seen counseling stations. Teach the patient something. On these stations, you'll be asked to counsel the patient into the use of an equipment or teach them about an ability for them to use. For example, teach the patient the use of an EpiPen or teach the patient the use of an inhaler. When it comes into teaching a patient, you have to bear in mind that a patient most commonly is not a healthcare associated worker. It doesn't have a medical background. So you have to use common and simple words to explain medical terms. Always avoid the usage of medical terms. And when you're explaining into a patient, please try to explain in small chunks of information and then check in with the patient to try to see whether he's understanding and acknowledging. For example, let's say we're gonna teach EpiPen use to a patient. How would you structure this? We will build rapport, we will start using our grips, we will do a very quick P3 maftosa relevant to the station. So if we're talking about EpiPen, we would ask about why the patient is using EpiPen, what events led to the patient to have an allergic reaction, how did he react to the allergic reaction, what treatments has he had, what is he allergic to. So we will be asking this question systemically in P1, presenting complaint, P2, has this ever happened before and how you've dealt with it, P3, other medical conditions, and maftosa relevant to this station of EpiPen counseling would be what medications he's taken, any, known allergies and how he reacts to these allergies, and any family history of allergies relevant to this station. Now, after doing our grapes and quick P3 maftosa, we jump into the important bit of counseling. We go into explaining the patient the use of an EpiPen. Remember not using medical terms and explaining in small chunks of information. Explain what's an EpiPen, why do we have to use the EpiPen, and when do we have to use the EpiPen. We can explain that, check for understanding or questions, and then jump to another chunk. We can divide in stepwise the use of EpiPen, check for understanding, and then safety net our patient and check for understanding. This is just an example on how you can potentially deliver the explanation of counseling. But the important points about this is to try to deliver the information in small chunks, checking for understanding, and always involving the patient. Remember, to score high in counseling and to have a very good IPS, you have to put always the patient in the center of decision making. Now, what other stations we can also see in counseling? Provide education in regards of smoking or drinking cessation. Providing educations in regards of treatment or procedures. Explaining results of investigations. Providing education in regards of sex or transgender. Explaining side effects commonly seen of medications. Alright, so thanks everyone for watching day 3 of our course. If you happen to have any questions, concerns, or doubts, write them down. You can ask us through our Telegram group or raise them up on our feedback session. Thanks for watching this video and see you in our next teaching session.